Postpartum hemorrhage is a common cause of maternal injuries. In one medical malpractice case, a 34-year-old patient came to the hospital in labor at 42 weeks. The decision was made to do a C-section because of Category 2 and 3 fetal heart tracings. After the delivery, there was a large amount of bleeding with boggy uterus. The physician and nurses took steps to address the bleeding and transferred her to the ICU. The patient was given 6 units of blood. None of the measures were effective, and the rapid response team was called due to continued bleeding. The patient arrested and resuscitation was unsuccessful. These events took place over an 18-hour time period. It was determined that the patient died due to hemorrhage and multiple organ failure. This example is not an isolated case. According to an investigation by USA Today, the United States tops other developed countries in the number of maternal deaths with 26.4 deaths per 100,000 live births. The best estimates say that half of these deaths were preventable. Because of this, we investigated our closed malpractice claims related to maternal injury. We looked at 94 claims involving maternal injuries that closed between 2013 and 2017 and found that postpartum hemorrhage was the main cause, making up 15% of these cases. In 45% of hemorrhage cases, the patient died. Hemorrhage also resulted in loss of the uterus. Our experts found that in 47% of the cases, injury or death was caused by the selection of the treatment in response to continued bleeding. Experts also found that in 40% of cases, injury or death was not due to negligence. Only 13% were due to inexperience with a procedure or poor technique. To prevent injury from hemorrhage, providers should use a classification system to determine each patient's risk of postpartum hemorrhage prior to delivery. They should estimate blood loss of every delivery to keep providers vigilant in the selection of management techniques to address excessive bleeding. And finally, to prepare for a crisis, we recommend that providers simulate serious OB emergencies.